Let's give a brief definition. It's a serious condition from the presence of harmful microorganisms in the blood or tissues and your body's response to prevent their harm to multiple organs, manifesting in shock and even death itself. So the most common causes are obviously bacterial infections, but it can be caused in reality by just about anything from viruses to fungal infections to parasitic infections. Anything that technically enters your body that's a microorganism can result in sepsis. So the symptoms of sepsis can range from altered mental status, which is actually something you're going to see in the elderly population, fever, body aches, chills, fatigue, shortness of breath, feeling just kind of faint and weak and dizzy. So as far as precautionary measures, make sure that you adhere to the vaccination schedule that your primary doctor recommends. Second, maintain proper hygiene, like with everything. Third, keep a healthy lifestyle of diet and exercise. Next, maintain compliance with whatever medical care and treatment that your primary doctor recommends. And lastly, if you're feeling sick, don't hesitate to go to the doctor or the ER because early recognition is really a key component of this. So I do want to emphasize that this is a disease process with early recognition that is treatable. So not to alarm anybody. But if you do go left untreated, you can develop high fever, dehydration, shock, and even organ failure itself. So far as treatment, there's a wide array of treatment that's out there. We early on hit you with fluids, provide that level of vascular support that your body needs. We have different lists of antibiotics that are broad spectrum that we can use to treat infections. If your blood pressure is a little bit on the fragile side, we have medications to support your blood pressure. And finally, we have all types of devices to help you with your respiratory support and care. So the approach to the treatment of sepsis is actually something that involves a multidisciplinary team. So we have emergency room physicians that are involved, as well as internal medicine physicians that are involved, as well as infectious disease specialists, nutritional specialists to help support your body and your diet while you're trying to heal through this process. And finally, intensivists that work in the ICU in case you were to transition into more of a serious state. So you can see it's not just one team of docs, it's a multidisciplinary attack to this process. So as far as how long you're going to stay in the hospital and what the expectation should be, I would love to give you a magical answer of 2 days or 3 days, but actually it's going to vary depending on the severity of your illness, the kind of organs that are affected, and how you're responding to therapy. So it can be from anywhere from 1 day to 2 days to weeks. Most people do well, like I said, with early recognition and early therapy. Because we're awesome. No, but more seriously, the reason to choose TVH is we have all these specialists and these multidisciplinary teams, and we have the experience in the management of this process to help co-manage this disease so that your health is improved.